Atypical hemolytic uremic syndrome, or aHUS, is a disease that causes blood clots in small blood vessels in your kidneys and other organs. These clots can lead to serious medical problems, including kidney failure. While there's no cure for aHUS, treatment can help manage the condition. Complications from aHUS can include hemolytic anemia, which means your red blood cells are dying faster than your body can make them, and thrombocytopenia, which is a low blood platelet count. aHUS is different from typical hemolytic uremic syndrome and can cause similar problems. It is usually caused by certain bacteria that can cause diarrhea, such as E. coli and Shigella. aHUS can affect people of any age, with an equal number of boys and girls getting it in childhood. In adulthood, more women than men tend to get it, often triggered by pregnancy. This syndrome is rare, with some studies suggesting it affects only 2 people out of every million in the US. Most cases of atypical hemolytic uremic syndrome, or aHUS, occur because of a gene mutation. However, the mutation itself isn't enough to cause the disease. The symptoms of aHUS start after certain triggers, such as pregnancy, infection, cancer, certain medications, organ transplant, or certain chronic diseases like systemic sclerosis or malignant hypertension. It's important to note that up to half of people with aHUS don't have a gene mutation that doctors can find. This type of aHUS is called idiopathic, meaning the cause is unknown. Researchers believe that these cases of aHUS are due to gene mutations that they haven't been able to identify. Atypical hemolytic uremic syndrome, or aHUS, can cause sudden symptoms after a trigger. These symptoms can range from mild to severe, with severe flare-ups potentially leading to kidney failure. Some early signs of aHUS include feeling weak and tired, as well as a general feeling of being unwell. If left undiagnosed, the symptoms of aHUS can worsen over time, leading to damage in various organs such as the kidneys, brain, liver, lungs, and heart. Complications of aHUS are common and can include kidney damage or failure, high blood pressure, heart disease or heart attack, headaches, double vision, facial paralysis, and seizures. Diagnosing atypical hemolytic uremic syndrome, or aHUS, can be difficult if it doesn't run in your family. A kidney doctor or blood doctor will be the most knowledgeable about aHUS and will look for certain signs, such as hemolytic anemia, a low platelet count, and kidney problems. You may also need a complete blood count test to measure your platelet and red blood cell levels. Your doctor may also check how well your kidneys are working with a routine test called eGFR. In addition, your doctor may test your blood for a specific protein called ADAMTS13 to rule out a condition called thrombotic thrombocytopenic purpura, or TTP. Genetic testing can also help your doctor determine if you have aHUS, but it may not always show the disease because not all the genes involved have been identified. When you go to the doctor, it's important to be prepared. Write down your symptoms and any questions you have. It can also be helpful to have a loved one with you to help you understand the information your doctor gives you. Here are some questions you can ask. What is the best treatment for me? What are the goals of treatment? Will my treatment have any side effects? Should I have a genetic test? Should I see a specialist? Are there any clinical trials I could be a part of? The FDA has approved 2 drugs to treat aHUS. Eculizumab, Soliris. Ravulizumab CWCZ, Ultomiris. Both drugs, eculizumab and ravulizumab, are monoclonal antibodies, which are human-made proteins that act like natural antibody proteins in your body. They attach to other proteins called antigens and tell your immune system to destroy cells with that antigen. Eculizumab can increase your blood platelet and red blood cell counts and may reverse any kidney damage if taken early enough. However, it may also cause side effects such as headache, irritated nose or throat, cold or flu-like symptoms, back pain, constipation, nausea, diarrhea, stomach pain, feeling dizzy, tired, weak, trouble sleeping, muscle or joint pain, arm or leg pain, muscle spasms, and hair loss. Ravulizumab, on the other hand, may cause side effects such as high blood pressure, headache, cold symptoms, diarrhea, nausea, and vomiting. Both eculizumab and ravulizumab are complement inhibitors, which may carry a risk of getting meningococcal disease. The CDC suggests people taking them get a meningococcal vaccine and take antibiotics to help prevent the disease. In addition to these drugs, you can also treat aHUS symptoms with plasma therapy. This therapy involves either a plasma infusion or a plasma exchange. In a plasma infusion, a doctor puts plasma from a donor into your body, while in a plasma exchange, a doctor filters plasma parts out of your blood and replaces them with donor plasma. If your kidneys don't respond to treatment, you may need kidney dialysis or a kidney transplant. For some people with atypical hemolytic uremic syndrome, they may experience occasional flare-ups, while others may have frequent and severe flare-ups. If diagnosed with aHUS, it may be necessary to stay in the hospital for a period of time. Although aHUS is a lifelong condition, with early treatment, the effects can be managed. It's important to stay in touch with your doctors so they can closely monitor your health and ensure you are receiving the appropriate therapies for managing symptoms. It's important to have a strong support system while managing your condition. Talking to family and friends can provide the emotional support you need. You can also ask your doctor about joining a support group, where you can connect with others who understand what you're going through. There are organizations that can provide valuable information, the latest research, and support for those dealing with aHUS and other rare diseases. Some of these organizations include aHUS Alliance and the Atypical HUS Foundation, which focus specifically on aHUS. Kidney-focused organizations such as American Association of Kidney Patients, American Kidney Fund, and National Kidney Foundation. Rare disease organizations like the Genetic and Rare Diseases Information Center and National Organization for Rare Disorders.